Hi everybody, this is Paul from Ortho Eval. Today I want to do a demonstration on hyperreflexia, a positive Hoffman sign, and I want to talk about the correlation here. So this young lady, she's 70 years old, has a history of some clumsiness, dropping a lot of things, dishes, glasses, things like that. She's also fallen a couple times unexpectedly with no real mechanism. And so what we find today as we do an evaluation, not only does she have a torn gluteus medius muscle, which we're addressing, but she also has some other interesting findings. During our evaluation, we noticed that she was hyperreflexive in the lower extremities. So when I tested her reflexes, and I'm just going to do one of them so you can see, I'm going to do the C6 reflex. Watch the hand here, okay, as I do that reflex. So she gets, some hyperreflexia there, but even a little bit of involvement at the fingers. Okay, see that? So her biceps are also hyperreflexive, and the triceps are hyperreflexive also. With that in mind, we go down and we check for clonus. And she gets just a little bit of bouncing, but nothing too severe, all right? The more concerning issue here is that when we do her Hoffman's test, which is stabilize the end of the finger and flick that, we take a look to see if her finger and thumb, or index finger and thumb, oppose and come together, okay? See that? So that's a positive Hoffman sign. If I do the other side, maybe hard for you to see, but she doesn't really present with a Hoffman sign on that side. So once we looked at that, we broke open her chart to find that she had had an MRI done of her cervical spine with some severe central cord stenosis at C4 and C5. There's really no cerebral spinal fluid getting through either at that level. So this is something that is going to be followed through with a neurosurgeon. She's going to be having some testing done before having surgery to open that up so that she doesn't develop some long-term problems. But those are some early signs and symptoms of a central cord stenosis. That's hyperreflexia, and at both the upper and lowers in a positive Hoffman's test. If you have any questions, please feel free to contact me at orthoevalpal.com or leave a comment down at the bottom of this page. Thanks.